welcome to What's My Tagline? I'm your host, Carol Flagg. Thanks for tuning in. On this show, we put our microphone in front of a variety of industry experts to understand the factors influencing messaging, branding, and reputation in healthcare. You can follow the conversation on Twitter at hashtag What's My Tagline. Be sure to follow me at Carol Flagg. My guest today is somebody I've known a lot of years, having attended the HIMSS conference for 10 years and post-HIMSS. And her name is Joyce Lofstrom, and she is with Ritz Communications. Joyce, thank you so much for joining us today.
I'm glad to be here, Carol. Thanks for having me.
Yeah, you've been on my radar for quite a while. I've known you for a long time, having attended many HIMSS, and of course you've since moved on and have a new gig going. But before we talk about that, the healthcare IT industry, my first question of all my guests is, if you had to describe yourself as a tagline, what would it be?
I've thought about this a lot, Carol, and I have. And
yeah, it's usually the hardest question I pose to all of my guests. Yeah.
I know it's kind of fun to think about, but I always come back to the same saying, which is, and I'm paraphrasing it, but it's life is what happens while you're making other plans. Yeah. And it's from John Lennon, one of the songs from the Beatles. I'm a huge Beatle fan, but I also think that for me in life, you can get so hung up or focused too much on one thing. It could be your job, it could be a lot of things, but that you also forget what's right in front of you, which is, your daily life. So I think that applies professionally and personally to me.
Yeah, I think it's so interesting. There's a lot of, and there has been certainly, I think, really since perhaps the invention of the internet and instant access to social media and email and all of that. I know that there's a lot of conversation these days around work-life balance, when to put the smartphone away, and I think that you're right. I love that lyric from John Lennon that you just quoted, but it certainly does resonate in the fact that we do get so myopic sometimes. Again, just sometimes right in front of our own nose with our smartphone, that we fail to see perhaps what else is going on around us.
Right, I agree. So it's something I strive for.
Yeah. I strive for it too. So funny. The previous guest I had on the show, talked a lot about this issue as well. So tell our audience a little bit about your background. You just, a little sort of, tour of the history of Joyce Lofstrom and your path into healthcare.
Sure. Well, I'm a native of Kansas City, Missouri. That's where I grew up.
I didn't know that.
Yes, that's where I grew up in the city, and have many good friends there, girlfriends, and my brother and his wife, and it's one of my favorite places to go back to regularly. But I kind of always wanted to be a writer. I wrote in high school. I wrote some things when I was young, so I wound up going to the University of Missouri, Columbia. But
great school.
Majored in journalism, and also in what was then called home economics. It's now human environmental sciences. I always wanted to be a dietitian, and I didn't wind up becoming a dietitian, but I took some nutrition classes, and during that era I was the food editor of the Columbia, Missouri, and the newspaper the journalism students put out. And I only mention all this, it's been a while since I was there, obviously, but it really kind of got me ready for my career, which became that of a writer. I worked a lot in nonprofits and with food and nutrition. I spent many years in PR and communications in that area. And probably my favorite job was being the food editor and a restaurant critic of a daily suburban newspaper here in Chicago.
Oh, how fun.
Yeah, it was great.
Which paper?
It's the Daily Herald. It's Arlington Heights. So I met a lot of people that way too, and actually that's how I got to HIMSS. I was with a small PR firm and left that firm because of just wrong fit, and started talking to people. And one of my friends from the newspaper said, I know HIMSS is looking for somebody. They were the agency for HIMSS at the time, and so that's how I got there, and that's how I got into health IT.
So just, if you don't mind my sharing, how many years ago was that?
I joined HIMSS in December of 2002.
That's 2002.
Yeah.
people forget how long it's been. I think that the original HIMSS organization started, I think, decades ago, many decades
61.
ago. Right?
It was founded in 1961. So
yeah. Well, that was back in the day when newspapers were flourishing. You may not remember that I actually have a newspaper background, and I think we actually talked about that one year at HIMSS of the publishing.
Did.
Yeah, we did, and of course, 2002. That was an interesting time. Obviously, post 9/11 and the recession that hit afterwards. Certainly, the newspaper industry was feeling the crunch. And what was going on in the health IT world in 2002?
Well, as I remember, EHRs and health IT were not as well recognized in terms of just even the term back then. It was there were certainly electronic health records in use, but it was still a challenge. I'll say to trade media were always interested in talking about what was happening, but we were trying to come up with other angles, stories to talk about what HIMSS was doing. I know we eventually founded HIMSS Analytics, so that was a big achievement just to expand into market research during those 16 almost years I was there. And it was, I would say, as time progressed, the big thing that changed everything obviously was the HITECH Act that happened in 2009. Which we all know about, but if we don't, it's when the government's actually incentivized physicians and hospitals to adopt electronic health records and help them do that. So, and I think that was the big turning point.
Yeah, about whether it's so funny. When I was at HIMSS, the HIMSS conference in Orlando this year, I was so nostalgic because it was literally February of 2019, so it was 10 years. Literally the 10-year anniversary of passing of ARA, which include the stimulus package, which included the HITECH Act. And I was shocked by how many people didn't that were there that didn't even know that. Like I kept saying, "Oh, I'm so like nostalgic, the 10 years," and they were like, "Oh, really?" It's just.
Well, I think that's kind of surprising because you would hope that history would be an important part of what we all recognize as we think about where we were and where we've come to right now. So, but
some of it was generational,
yes,
I think
it's true.
Yeah. Some people were like, "Oh yeah, of course," and then others were like, "Yeah, if they weren't in, if you weren't in health IT back then, you just, if you joined health IT in the last few years, that we sort of stopped talking about meaningful use since the passing of MACRA,
Yes.
Meaningful use is still an issue, certainly somewhat on the hospital side and winding down on the Medicaid side, but, people, it's just that forgotten term, I think.
Yes, I think you're right because we've moved on to something else now, and and I think that's probably the beauty of health IT is the beauty and the challenge is the evolution of it, and it's still evolving to become what we want it to be, which I'm not sure everybody knows yet, but we're getting there in terms of being able to share information across systems and so forth. I think that's, as we know, that's a big topic right now of how to do it. Can we do it? So
yeah, I think that's a really interesting point. I think that for a lot of attendees and perhaps even on the vendor side, when the HITECH Act passed and they shepherded in the incentive program to it was sort of the carrot came first and then the stick in terms of penalties for Medicare and Medicare reimbursements for hospitals and physicians. I think that there was sort of a feeling for a few years there that it was really just all about meaningful use. Get your incentives. Here's how you do it. Here's the path. And perhaps people had to step back and recognize. I think once we were sort of out of there from like 2011, 2014, that actually the HITECH Act was really just a program to kickstart it, that was never really the end-all and be-all of adopting health IT technology.
I think that's a really good way to look at it, Carol, as a kickstart to get it going, to get the electronic health records in place, and now they're in place, and so what can we do to improve upon them? And make them better. And as I said earlier, and we've all said, to make sure that they can share information across all the systems and locations. Because we've all been there where I have carried paper records around trying to get to different doctors over time. And, it's very nice to have that access now as a patient and for the clinicians where they can find those records and you don't have to worry about doing that. So now we just have to get it to go across all the systems. So
interoperability, which sort of does still seem like quite the holy grail, doesn't it, for the health IT industry?
Yes, it does. Yep, it does. It's what we need to make it work for everybody. So I think we'll get there. It's just like you said, we kick-started the program, and so we're building on that kickstart right now.
Yeah. And for those of you tuning in and maybe not quite sure when we talk about interoperability, what Joyce and I are sort of talking about, this idea of in essence mirroring the banking system where your health record moves seamlessly, through obviously a secure process from one healthcare provider to another, physician to specialist, specialist to hospital, and certainly vice versa, the other way around.
That's correct. So now that's a good analogy too, because I think people understand it more clearly when you think about your ATM, banking, or airline reservations. Those are two business models I think that health IT aspires to in terms of being interoperable and the ease of use. So you've been in the healthcare and specifically the health IT space, I guess, for 17, 18 years now, somewhere around there, if I'm doing my math correctly. Yeah. And I've been in it for 10. You've seen progress, right? In your opinion, have we made progress? And where has that progress come from? Well, I think we definitely have made progress, and I will say that just based on going to I'll say to my personal physician and the hospital system I go to, and the clinicians, they all use electronic health records. They all access my information through the computer. And if I go to a different doctor outside of that system, surprisingly, I'll say, they've been also able to access those records. So to me, that's big progress. And I also think that I think all of us in the different sectors, so to speak, of healthcare, whether you're the provider, the vendor, the payer, I think the other thing that's coming to fruition, and I just think people are accepting it more as a reality, we all have to work together. It's not a siloed approach where one group is going to do something over here and then another group. It's been that way, but I think to really make it succeed, we have to work together. And I see some of that happening.
Yeah, and certainly, I would say that that's definitely the feeling that you get in the industry. As we go to these conferences around the country and even internationally, this idea that it is going to take everybody working together to make interoperability a reality, to really, use all the data that's being collected to predict outcomes, the role of AI in all of this, and obviously, and not to get too into the weeds as far as legislation goes, but there's a proposed rule out there that talks about information blocking that's currently out for comment. So this CMS and the ONC, I think, obviously are trying to foster as well this issue that all these entities, the providers, the payers, the vendors, that we all have to work together to improve healthcare.
Right. And I think we could go on a whole nother show probably and talk about that whole business side of it and what you want to share and don't want to share and that kind of thing. But in the long run, I think it will help every business model, because then things can move ahead and more people, more providers will be using X, Y, and Z, whatever. You know what I mean? I think, I just think it makes a big difference if we try to solve the challenges together. That's overly simplistic, perhaps, but
yeah, I agree with you. And some of those, I think some of those challenges that are being solved, as far as access to records, access to how you communicate with your doctor are simply being solved because, over the last, your time in healthcare and IT and my time in the last 10 years, technology through smartphones and apps and patient portals is just changing how the patient is looking to communicate with us. So I think some of these changes that we're talking about and, working together are being created on the consumer side. This idea that the consumer is putting emphasis on how they want to communicate with their providers.
Right. I think that's very true, and I think the providers are listening as well because they see, I would hope they would see more patient engagement that way. If you have
Yes.
the patient, you have an app or something that allows you to take better care of yourself, and then you can work with your clinician or doctor to talk about it and, make a plan, so to speak.
Yeah. It was interesting, certainly, I think, when we're gonna move off the topic of HIMSS here shortly, but I thought it was very interesting at HIMSS this year seeing the biggest names in retail on the exhibit floor, right? Google and Amazon,
right.
These companies where Uber, that where you don't expect them to sort of, somehow appear magically at this large health IT conference, and yet there they were having a huge impact on the conversation.
And they are, because that goes back to your comment about how the consumer and the patients are driving some of the changes. I think that's a good example of seeing those companies there and how patients, how they shop. They shop for whatever they want to buy. They also are starting to shop now for healthcare services and whatever. So I think that's a big change that will continue.
Yeah. If you're just tuning in, I'm talking with Joyce Lofstrom of Ritz Communications, and you're listening to What's My Tagline. So Joyce, tell us what you're doing today. I know you're at Ritz Communications. I know you're still, and you've got your own thing going as well, and I know you're still actually writing, aren't you? You're still in the communication, PR agency, spread the message kind of mode, correct?
That's correct, Carol. I left HIMSS in May of 2018 and started my own business. And in the businesses, it's like freelancing. It's writing, editing, those kinds of things, and PR. So I joined Ritz Communications right away, and Ritz is a virtual PR firm that works with a variety of clients across the country, and have been working with them quite a bit, almost full time, and enjoy it, and do a lot of writing. It's probably one of my favorite things to do in terms of a job, and it's been good.
Yeah, and now does the agency focus in on healthcare and health IT, or do they touch other verticals, or you
it's
just still in?
It's healthcare. And sorry, I didn't mean to interrupt you, but it's healthcare. Yeah, healthcare, health IT. So that's the main focus.
So you're still working with healthcare IT clients and doing press releases. I'm just curious because you talked about your passion at the start of our conversation related to food writing and health and nutrition. Is that still part of your life?
I don't do much food writing at all anymore. I still pay attention a lot to what's going on nutrition-wise, just in general and with my family. But no, I left that behind when I joined HIMSS. It was a transition that I made, and so it's always going to be a big part of me because I did so many fun things with it during those years. I was part of that industry. But, I always figured, too, that healthcare and food, it relates, and so there's a big IT component as well with dietetics and nutrition that can be part of an electronic health record. So, we're all together trying to make everybody healthier. So
yeah. I think that it's a big issue in this country.
Yes. Yeah.
With the diabetes crisis and the opioid crisis, which is not food related, but certainly has unfortunately another aspect of what the healthcare system is dealing with as far as pressure points.
Yes.
I think that is a conversation that is going on a lot right now, and sort of weaving in the social determinants of healthcare as well. How can we use, that's a good question, because I think about this a lot, like how can we use health IT technology to help with these huge pressures and burdens on our healthcare system? Diabetes is rampant among children, unfortunately. The opioid crisis, infant mortality rates are, I think we're like 36th or 37th in the world. I was talking with somebody at HIMSS who said you're safer having a baby in Turkey than you are here in the U.S. When for high risk pregnancies. So I'm just curious, because you've been in this business for a long time. Where do you see health IT perhaps getting a role in solving some of these challenges?
Well, I will go off of one of my philosophical beliefs, and I'll just say that I think the main thing that we have to solve as a country is poverty, and I think once we address that in a better way. Now, I don't have a solution to address that, but many of the aspects of poverty appear in determinants of health. So I think it can work together. To your question, Carol, that how can health IT help with that? I mean, so if somebody has a doctor's appointment and can't get there to be in better health, so is there a way to send them a reminder on their cell phone, or is there a way to get them to the doctor's appointment, or anything, those kinds of things that to many of us are just basics. It's like, oh yeah, I have an appointment, I'll be there, I'll get in my car and drive. Well, if you don't have that kind of access, you don't have money to take a bus, or there isn't transportation close to you, what can we do to improve that? So I think IT is kind of a subset of addressing the overall problem, and then I think health IT can help track some of those issues and help people fulfill related things, like an appointment is what I'm thinking of right now as I talk about it. But it's a big issue. I mean, it's a lot. So
and you're right. There are thankfully health IT solutions out there. How they are tracking people, not tracking people from a Big Brother standpoint, but from the front end, getting the information about that person's home life or work life, so that they can help them become healthier. Certainly, childhood obesity, a lot of those are related to income issues, because frankly it's cheaper to feed your child fast food than it is healthy food. We live in a country where, unfortunately, that's the case. So,
early in my career, I worked at Children's Mercy Hospital in Kansas City. I worked there 2 summers in college, and then I worked with the WIC program later. And the reason I want to just mention that is to your point about childhood obesity. I worked in the nutrition department in Lillis, who was my boss at the time. She was a registered dietitian. I mean, there were a lot of obese young, kids that came in there, and adolescents, and we would talk to them about what they could eat or what they should eat, and they didn't have the money to go buy fresh fruit and vegetables every day, and they were in a food desert. There wasn't a grocery store close to where many of these families lived, and I just think it's interesting, because that was, 3 or 4 decades ago, and here we are talking about the same issues. So
right. It's probably gotten worse, unfortunately. It's hard to believe. That's really interesting. Well, Joyce, believe it or not, we only have a couple of minutes left. I feel like we're just sitting there having a glass of wine somewhere at one of these conferences that we attend.
Next conference, Carol. So
next conference, Well, exactly. So what's next for you, from a conference standpoint, or just in work or life in general?
Oh gosh, that's a good question. I mean, I'm just, every day you just kind of keep doing what you're doing with job-wise, which is what I will be doing. Conference-wise, I haven't thought about that yet. I've gone to many PRSA conferences, Public Relations Society of America, so I always enjoy those. And then HITMIC will be coming up in a few months. That's another year, I guess. But those are 2 that are on my radar.
Yeah, it was great seeing you at Boston at HITMIC. That was a great conference.
It was very good. So my first one.
Yeah, it's kind of nice to have a conference, just for the marketing and PR agency folks for us to have a chance to learn different things. So
yes, I agree.
I agree. And where can our audience find you? I think the best place perhaps might be to connect with you on LinkedIn, correct?
I think so, yeah. That'd be great, Carol. Yeah.
Oh, great. Joyce, it's been so much fun talking to you today and catching up.
Same here. I really enjoyed it. Thanks for the invitation.
Yeah, thank you. You can share your thoughts or comments on Twitter at #What'sMyTagline or visit the program page on HealthcareNOWradio.com. Have a topic related to our show you want to hear about, or you're an expert who'd like to be on the show. Reach out to me on Twitter at Carol Flagg or email me at carol@HealthcareNOWradio.com. Until next time, I'm Carol Flagg, and I want to know, what's your tagline?